Good evening, everyone. I'm Dr. Tunde Adefair, and I'm reaching out to you live from Abuja. This is we're having consultations here in Abuja, and right now I'm in the Abuja clinic. But as it's our tradition, every Friday Vinci Hair Clinic comes right online, and we have our Confident You live video series. Confident You. So what we basically do is we discuss several health topics that we believe will be of benefit to everyone. All right. So every Friday we come online and we learn something new about how to stay healthy and how to stay confident and how to look beautiful and how to what measures we can take to ensure that we stay in good health even in these trying times. Right, so once again, this is Dr. Tunde Adefe from Vinci Hair Clinic, and we have the Confidence You live video series. Today, I'm going to be having a wonderful guest with us. She's a pharmacist and she works with the popular Medplus. Right, so our pharmacist today will be coming up and she's going to be talking to us about a very, very interesting topic. Right, so supplements. We've all heard the word supplements before. What are supplements? When do you need a supplement? Is a supplement one supplement meant for everybody? Can an adult use a supplement? Can a young person use a supplement? Of course, you know that there's the era of the COVID right now, and people are wondering what can I do to boost my immunity. We're talking about supplements, and we will also talk about myths and talk about the do's, the don'ts. All right, so I implore you to all stay with us. We will be bringing pharmacist Bunmi Ogunnibe actually, pharmacist Bunmi Ogunnibe online shortly, and she's going to be giving us, we're going to be talking about supplements, and I hope it's going to be a very interesting one. So right now, I can see a lot of people here have joined. I can see Fine Young, I can see Osborne Isu, see Borocoms, I can see the clinic from Ghana has equally joined. And I can see the pharmacist Bunmi Ogunnibe is equally here. And I can see a wave. Right, so let me invite her to join this session. All right, so we're bringing. So, prepare your questions and I'll be writing them down so that at the end of the entire live show, she can discuss some of the questions. Hi, Bunmi.
Hi.
All right, so yes, your screen is upside down. Is there a way you can just turn the phone? Yeah. Right, everyone, like I said, prepare your questions, listen attentively. Lots of information is going to be shared right here on this particular platform. It's the Confidence You Live video series presented to you by Vinci Hair Clinic, and I'm Dr. Tunde. So we're waiting for our pharmacist, our renowned pharmacist. Like I said, she works with Medplus, and she's, of course, having lots of information that she can share with us. She's the person that we can trust. What she's going to be sharing with us as far as supplements are concerned. Okay, so she probably had an issue there. So I'm going to once again bring Oluvimi back. Somebody says you guys should do a hair transplant giveaway now. Mr. Hudson JB, why don't you send us a DM? Let's talk about that. Okay, send us a DM. Let's check. You might just be surprised that a hair transplant might not be what you need. Perhaps you need something different. But send us a DM. All right. Let's talk about hair transplant for you. Okay. All right. So I'm trying to bring you back. Voila. This is beautiful. Okay. It's so good to see you. We've spoken on the phone.
Yeah. So good to see you.
But it's nice to meet you in person.
Yeah.
All right, everyone. Once again, it's the Confidence You live video series. And today we have pharmacist Bunmi Ogunnibe talking to us today. Okay, so the topic we have before us is the importance. Okay, supplement for a healthy you. All right. So I mean, supplements might seem like a common word, but like a professional, I'd like you to tell us what exactly, how would we define supplements, in lay terms, so everybody can understand.
All right. First of all, Dr. Tunde, I'd like to appreciate you and the entire
Thank you.
management of Vinci Hair Clinic for having us here. That is Medplus.
Thank you.
It's a privilege. All right. Supplement is actually one of the most abused words in the world right now. Thanks and no thanks to COVID. You know,
Wow.
what we see now is people walk into the pharmacy and say, can I have a supplement to prevent COVID or supplement to boost my immune system? Or most people oftentimes don't know what that is. So supplement actually refers to, we call supplement any substance you would ingest that would help you like kind of supplement your diet. Any substance you would ingest that would supplement nutrients that you could have gotten from food. Or any substance you would ingest or eat or drink that would actually help you prevent an illness. So it's either you're replenishing what you should have gotten from meals, or you're trying to prevent an illness or a medical condition. Such substances are referred to as supplements. And usually supplements can come in different types. You could have them in tablet form, capsule, powder, liquid, and so on. And then we have about 5 things that majorly supplements will contain or have. But either the vitamins and minerals, vitamins like vitamin A, B, C, D, and then minerals like selenium, and the rest. Then you could have a supplement that will contain fiber, like psyllium ox, or probiotics, like lactobacillus acidophilus. I will go in and explain more of that. And then you could just have basically your proteins, your amino acids as supplements. So it's either it's helping boost your immune system to prevent an illness, or you're trying to supplement what you have gotten from diet. So that's what supplement is about basically.
Wow. So obviously it's beyond the scope of tablets and the several kind of forms of liquid that we get from the pharmacy.
Yeah.
All right, interesting. Thanks for the definition. So now we talked about definition. What do you think? I mean, what are the benefits of supplements generally?
Well, like I mentioned while I was trying to give a background to supplements, basically the first thing you stand to gain if you would kind of get supplements and use supplements is it will help boost your natural defense system. You know, the way God has configured the body, or the way the body is that we have some defense, you know, like goalkeepers in our body. They kind of trap diseases and foreign things in the body and do away with them, preventing them from entering the body and causing havoc. So we call them the host defense system or host immune system. So that's the number one thing you stand to gain if you actually make use of supplements. You use supplements that will boost your immune system. You can also use supplements that will make you look more beautiful, like for your skin, for your hair, for your nails. You could also make use of supplements that would help manage an existing condition. For instance, high blood pressure, well, they would take what their doctor has recommended, which we always advise they do. They could also make use of supplements to prevent further deterioration of certain parts of the body, like the heart, the liver, the kidney, or also help prevent these diseases from progressing. So you actually stand to gain a lot when you use supplements. But one thing is sure, there's no one supplement fits all. Like anytime you need to get a supplement, it has to be who needs it and why you need it. So it's either you're using it for general body wellness, or using it for a certain thing, like maybe beauty, improve your looks, to have a better glowing skin, you know. Possibly to manage a condition, an existing condition, or even prevent it, you know. So you start to gain a lot. Children too can benefit. All categories of people can benefit from the use of supplements. Excuse me. From children to adults, men, women, athletes. If you are into physical activity, exercise, you need to supplement with amino acids to help build muscles and prevent damage to tissues and the rest. Or even just the beauty enthusiasts, people that just want to look good and feel good. And we have, this time around, we have people trying not to age, which is a good thing, by the way. So at, so at 80, you look 30, you know, it's possible, and we have people achieve that. So you can use supplements too.
All right. So you mentioned supplements for different categories of people. All right. So because just trying to dispel a common practice, especially in Nigeria and other parts of Africa, where a parent can go to the pharmacy and get a bottle of any kind of supplement, and they make the entire family use it, irregardless of the age, the sex, gender. So, I mean, are you for this or you're against it?
Well, I would say I'm against it, yes, because like I mentioned earlier, we have different types of supplements. So I'm assuming such mother will do that out of love.
Okay.
However, that could be harmful. So if the mother is getting vitamin C, for instance, let me use vitamin C. That's the most accessible and the most common type of supplement. So you buy vitamin C and then you get 1,000 milligram, which usually you can get from our stores in Medplus Phar, any of our stores, and then you buy that. An adult will take 500 milligram, 1,000 milligram, or maybe just a tablet dissolved in water. Imagine giving that preparation to a 2-year-old to drink all at once.
So that means there's a chance of overdosing.
Exactly what I'm trying to say. Overdosing.
Wow.
Yeah. So, but with supplements, the most important thing is who needs it, what for, and the dose. So vitamin C, adults can use it, children can use it, men can use it, women can use it. I mean, practically all of us can use vitamin C, except for some categories like ulcerative patients with ulcer and some other people that can't give vitamin C. But the dose matters. So it's always good. I would advise, the advice is simple here. If you would use a supplement, talk to your doctor or your pharmacist before you get one. And then life is easier now. We have we have 59 stores currently in Medplus. So we are practically everywhere.
Congratulations.
Enter one of our stores, get to speak with a professional, a pharmacist, a Medplus pharmacist, and then we help you out.
Well, it's comforting to know. It's comforting to know you have branches around, and that you have professionals in there that can guide people as to the choice of what to take, which supplements to buy.
Exactly.
Right. I mean, that was just one scenario, but you see, there are other myths. There are other wrong opinions, wrong notions surrounding the use of supplements.
Yeah.
So I don't know if you could just touch a few.
Dr. Today, I kind of lost you there.
Right, the question is this. There are wrong notions about the use of supplements. Wrong beliefs. There are myths out there.
Exactly.
So I was hoping you could help us clarify some.
Oh, okay. Yeah. I think I would first of all mention that the most common one is people say, Bunmi, I eat well. I prepare my food myself. I don't eat out like other people. I don't think I need supplement because I have everything I need in the food I'm preparing. I've prepared for myself. So we have some sect of people that will tell you because they eat so well, they try to eat well, why would they buy supplements? Well, I would say that if you get all that you need from meals, that's perfect. You may not need. And the word is may, not. The reality is time and money is a huge constraint to the kind of food we eat. Sometimes you have the right food in front of you, but you don't have the time to do that. Sometimes you even have the time, but you don't have the luxury, the money, or the logistics to get the food together. So you still need supplements, at least one or two, just to supplement whatever it is you are taking in. And then we have this other sector. I would say that I'm taking a supplement. Does that mean I have to still watch what I eat? For instance, the Medplus people, Bunmi, I'm taking possibly apple cider vinegar, I'm taking Garcinia Cambogia. Do I still need to watch what I eat? Yes. That you are using supplement does not mean you should indulge and throw away what you normally do. Discipline is still of utmost importance here. And okay, those are the two most common ones. But we have people that would say that, okay, supplements are natural. Can I just consume as many as I want? All supplements are natural. They should be safe, right? Well, not to shock you, they may not be safe. They may be safe or may not be safe. You know, that something is natural does not mean it is safe. For instance, arsenic is natural and it's not safe. Lead is natural and it's not safe. We have certain types of mushroom that are very natural, but they are not safe. They are not edible. So yes, that's why you need to speak with a doctor or a pharmacist before you get supplements or before you make use of supplements. And then you'll be getting your money's worth, much more than that. You know, it will help you with life in general. So one other thing belief mindset that people have is that supplements should not interact with my medication, right? Take for instance, I'm taking medication for arthritis. I have knee pain. Doctor has diagnosed it as arthritis. I'm using my diclofenac. I'm using my normal medication. That I'm using a supplement now. Does that mean it won't interact with it? But supplements can interact with medication. Even food can interact with medication. We know grape juice, and interact with blood pressure medication. So you still have to be careful about that, but nothing to be afraid about. Speak with a professional, a doctor or a pharmacist. And then, like I mentioned earlier, life is better now. You really can just walk into any Medplus store, speak with a pharmacist. If you need to speak with a doctor, they will advise you, and then they'll walk you through it. But if it's something they can explain to you, ask them all the questions that you're walking with you, you know. So I think that I would stop there about some two other things later.
So you mentioned something about the intake of grapes and then the blood pressure medications.
Yeah.
I mean, I'm sure people are listening and they've marked it because there are people here in Nigeria who have hypertension and they're taking medications as well. So they really need to be notified that grapes could actually have an effect, considering the drugs that they're taking. This one I'd like to ask you.
Okay.
When I started working in the general hospital initially, before here, we were told that you should not use multivite when you are taking anti-malarial medicines. This is what we were told.
Yeah.
What is the update on this matter? Well, it used to be a bone of contention between doctors and pharmacists. All right, so let's head to this battle.
That's an age-long battle, and I doubt if we can settle it here, but this is what I'll tell you. The interaction between multivitamins, particularly vitamin C, particularly antioxidants, and anti-malaria, it's minute. It is very minute. It's such that if a normally healthy person just have malaria, there's no resistant malaria here. It's just the regular malaria. I mean, you treat it once, it's gone, and then you use vitamin C with it. You may literally not have any form of resistance or, interaction. But the challenge is if you have someone with resistant malaria, or someone with other ailments or existing condition, you need all the help you can get to make sure the medication works. In that case, no matter how little the interaction is, it could then interfere. So it's more of, if you ask me, this Bunmi submission, from the basis I've just told you, it's more of a case of risk-benefit ratio. But normally what we'll tell people is, why not wait till you finish you complete your medications anyway, since it's just 3 days. But the case is, if you have someone that is severely anemic, and the person now has malaria, would you not supplement? If you need to, you would. But if it's not something that is life-threatening, you just tell the person to hold on. That's the general rule. Rule of thumb is you hold on, finish your medication before you start your supplement. But in case of life-threatening or possibly other cases like I've mentioned a few, you can use it together.
Okay.
This will
All right.
solution and science-based, it's evidence-based.
All right. So I got a feedback in there. It appears my voice is echoing. Do you have like an earpiece somewhere around?
No.
All right. So we're just going to continue.
Okay.
So what happens is that
Doctor, today you want to make use of an earpiece?
Yes, if you can.
No, I have.
Okay, is it just close by?
It is.
All right, let's do that. All right. So let's just give her a minute. We can continue.
Sorry, guys.
Okay.
Hi,
Wow, so that has
sorry
taken
about that.
work.
Okay, great.
Okay.
Sorry about that.
Now there's something. I like the fact that you've helped us clarify the fact that oranges, vitamin C with the use of antimalarials. I think eventually everything boils down to the fact that you need to speak to a professional, a pharmacist, a doctor. Okay, so you can know whether to combine these two or to work without them.
Exactly.
All
You can't self-medicate, yeah.
Okay, I'm going to put lots of viewers and listeners on the spot right now. Now, when we were young, our grandmas, especially here in Africa, our grandmas would go to the bush, they pick one or two leaves, they pick one or two roots together, they boil it, and they call it herbs, aka agbo. Now, you'll be surprised to know that even some medical professionals, and I mean professionals, our consultants, I didn't say nothing, our consultants sometimes use these things called agbo. Now, to be honest with you, I frankly don't like the use of this thing called agbo. But many people in Nigeria, they use agbo. If you just stand on the road, you will see that there are several women who are selling all sorts, and they call it agbo. Somebody's going to come and he tells you he has back pain. Yorubas call it jedi, all these funny names, and they have different names for these different concoctions and mixtures. Please,
in different colors.
In different colors, in different forms, with alcohol, without alcohol.
Exactly.
What do you have to say? Is agbo or the herb? Is it a supplement? Are people advised to take this kind of concoctions?
Well, this is what I know. Thankfully, I studied pharmacognosy in school. Medications are practically gotten from drugs. About 70% of all medication comes from herbs, plants. Plants. Okay. Those are herbs anyways. But the difference is that once you identify a plant that works, a plant is like a family, like a clan. They have different agents, different people, so it's for lack of a better word, so people can understand. Imagine different soldiers, different, So you have to identify and isolate that particular element that works in a drug, in the plant, in the herb, and then you formulate into drug form. The challenge with herbs, so herbs is good, right? Yes, but the challenge with herbs is that once you pluck the leaf or you take the root, you have a whole lot of things in there. The primary metabolite, that's what works, and then the secondary. And at the point of using it, most times people mix different plants together. Now, it's as if you are mixing all sorts of metabolites, all sorts of constituents together. An interaction could happen at that point. Exactly. They could even interact and then cause harm at the end of the day. And one other thing is that when you eat and when you use medication, most times our liver metabolizes this. most drugs is heavily they are heavily metabolized by the liver. So imagine having to give your liver extra work to do by mixing all these things together. So it's safer buying a supplement that has been isolated. For instance, garlic. Garlic is the bulb, is the plant. But what works in it is allicin. Is it for its antibiotic property? Is it for the antihypertensive property? It's allicin.
Yeah.
So by the time you are buying such, it's been extracted. You could even literally see we call it standardization has happened.
Okay.
It's been standardized, and then you know what you are taking. So that, apart from interaction, apart from the liver damage, there's also the risk of overdose, because they are not quantified anyways. Just assume after drinking a cup, I should be fine. Then they have to you take another cup of the agbo, and then at night you do that. So these are not quantified. It could either be underdosing or overdosing. And then in most cases, people continue to use this agbo or this preparation with their regular medication. And that can cause a lot of interaction. Even we have people that would say, I've met someone that would say, oh, once I drink my agbo that my mom has prepared for me or my grandma, I'll just go to the village. This thing is becoming too stubborn for Oyibo medication. I'll go to my village, they will prepare something for me. I've had people say that. I've seen people tell me to my face. But the challenge is for hypertension and diabetes, majorly. They go back to the village, they give them these preparations that as a pharmacist, if you look at the individual constituents, may not be too bad in terms of what works. Okay. But because it's not standardized, there's a diabetic patient, for instance, could either be hypoglycemic at the end of the day, which is even worse than the hyperglycemic, and the person just collapses and die, you know? Or even hypertension because they stopped its medication, or in a case of using it together. I mean, bottom line, I think it's better people talk to professionals and then not try to separate the two. Like, it's good as professionals as well. You are a doctor, I'm a pharmacist. We should not be judgmental. When someone comes to us and they start talking about all these native related things, we should be open-hearted. No, not you as a person. I mean, medical folks, you know, we should try to listen well and get what they're trying to say, and then we know how to come in and put this across to them so they can get the best out of it. But using herbs, go ahead, please.
So obviously some of these herbs are useful, but
exactly,
like in medical trials, they need to go through different levels of scrutiny so that we
clinical
can know
trials,
the dose, the frequency, you know, stuff like that.
Exactly.
So, okay, once again, you all have to speak to somebody, a professional that knows more about this before you take them, right?
Yeah. Please do. And again, feel free to walk into any of our stores to ask questions. I know this is just a short, we have just a little time to talk about this here.
Okay, so most of the guys that we have on this platform are concerned about hair. You know, they want to have good hair, healthy hair. So I'm going to take you into that field of hair restoration right now.
Bring it on.
I'm going to let you talk about. Tell me, please. You know, what kind of diet do you think is good for the hair? What nutrients? What do you think? What supplements can we take for the hair that's good?
All right. Okay, I'll start by talking about the largest protein in the body. That's collagen. Collagen is very primary for hair growth. Vitamin C will aid, so that's another one. Vitamin C will aid in collagen synthesis. So apart from collagen, you're talking about vitamin C here. Vitamin A, very good for the moisture and the moisturizing of the hair. Vitamin A. Then E as well. Zinc is very important. Zinc actually is a cofactor for many enzymes to perform their work in the body, including the hair. Then you have selenium, vitamin D, our guy vitamin D. COVID has made vitamin D come out and shine now. So vitamin D also help with the hair. So these are a few supplements that can be used for the hair. Keratin, not to leave keratin out. Keratin is the primary protein that helps with the scalp and then the hair follicles. So these are a few supplements one can use. However, again, you need to talk to a professional before you buy all these things, because as good as they are, You don't want to overdose. You don't want toxicity to occur. Some of these vitamins are fat soluble,
Oh, okay.
while some are water soluble. So you need to know how best to take them, when to take them, and then if it's okay to take them if you have certain conditions, medical conditions. However, you can actually get the supplement that I've mentioned from meals, from food. Yeah, from your sweet potato, you get vitamin A from carrots, from sweet potato. Vitamin B, yes, I left out vitamin B, biotin. B7, very
Very
important for
important.
very, very. And then you can get that. It's just that at the end of the day, if someone is deficient in any of these vitamins, it could lead to hair loss, thinning of the hair, breakage of the hair, and of course, we all know what hair is. Hair is part of beauty. You have your hair good, you have good self-esteem, you are more confident than usual. And then we see that in ladies when we just finish making our hair, the way we do the shakara, and then for guys nowadays with the different cuts. And thanks to Vinci Hair Clinic, I watched some of your procedures online. Fantastic, beautiful. I mean, giving men confidence, women confidence, restoring, receded hair and all sorts. So, yeah, you need to look good. You take supplements to help prevent such hair loss, and then you eat well. Peradventure, it's already falling off or thinning out. You speak to someone like Dr. Tunde. It's going to help you out there.
Thank you. Yeah. I'm going to share something with you right now. From a consultation I had here in the clinic, some people come and they're like, "Doctor, I've used rice water on my hair. Some people have used mashed onions on their hair, and they claim that this is probably help." So please, what do you have to say about this? Mashed onions, rice water, how does it really help the hair?
Well, in some cases they do. I know someone that uses avocado pear, the local one, the one we have in Nigeria, mix it with honey and banana and yogurt, and uses it to moisturize conditions her hair. She did it for a while. Initially, very long hair. However, the but is simple. Let me tell you what happens. Avocado has E in it. I mentioned vitamin E earlier, right? Honey is a good moisturizer. Okay, yogurt, probiotics, and then you have some antioxidants, super antioxidants in all these fruits that would help the hair follicles, prevent them from being damaged. So it's all medicine at the end of the day. That is for someone that is trying to prevent. They work excellently well as home remedy, like do it yourself kind of thing. It can go wrong anyways, but for do it yourself, it's fine. However, if someone has challenges, medical challenges with their hair already, you really can't go get far with that kind of thing. But to prevent, and then you do self-care for your hair. Onion water, mashed onion, I don't know so much about that. Rice water, I really can't tell. I don't know, but I know some good home remedies that you can use.
Well, everyone, you have heard from our esteemed pharmacist, Bunmi, and she has explained to everyone, what supplements are, why we need supplements, who needs the supplements, and we've put some myths aside, talking about herbs in our community and all of that. Also, we talked about hair and some home remedies that people have used to help restore their hair. So Dr. Bunmi has been very, very helpful, and I want to say a big thank you. Medical professional,
thank you.
It's a Friday evening, and I want to say thank you for coming down to talk to our clients today. Of course, this video will also be put on our page so that those who were not able to watch will also benefit from what happened. I've seen through the comment section there's been that much questions. So I'll just simply say, do you have any closing remarks that you want to give everyone so they can take that home as a summary?
All right. First of all, I would like to appreciate you guys again, Vinci Hair Clinic, Nigeria, for what you're doing for us, I also thank you, that's from Medplus Pharmacy, for having us join you. I want to thank all the participants for listening, taking time to join in and be a part of this. But as per the topic that we just finished talking about supplements for a healthy you, it's important you speak with a professional as regards the type of supplement that is best suited to you. You can have it, the easy way by walking into any Medplus pharmacy, speak with a pharmacist, and then we break things down to you, to your level. We are like you're walking Google again, like Google, like I mentioned earlier. Eat well, yes, eat well. By well, I don't mean in volumes. I mean the different vitamins and minerals, quality. Yes, try your best to eat well. Supplements, vitamin C is your friend, zinc is your friend. During this COVID now, I mean zinc, vitamin D, and vitamin C, zinc, and vitamin D are very essential for you. Okay. Come in, let's walk you through what you need to know, and then I'm sure you'll be glad you did. Thank you very much again.
Well, thank you once again, Pharmacist Bunmi, and I believe sometime later we can probably reach out to you for more information.
Yeah, okay. No, voila.
All right. So my regards to the entire team and Medplus. Thank you for joining us today.
Thank you. Thank you for having us. Thank you. Bye.
All right. Bye. Right, everyone, that was Pharmacist Bunmi talking to us about supplements for a healthy you. And you've heard her story, you've heard Ka giving us a very strong points. There are lots of medications out there, supplements they call them, but you should not self-medicate. Speak to a professional, speak to a pharmacist, speak to a doctor, and they can advise you. In the era of COVID, COVID is not yet gone. You need to protect yourself. The basic principles: social distancing, wash your hands, wear a mask, don't stay in crowded areas, okay? But also the supplements. And she mentioned vitamin D, she mentioned zinc. All right, so let's take all of this into cognizance. And talking about hair, there are supplements she also listed, okay? Some of these things you cannot take in isolation, you need to take as a group. If you're having questions, you could contact Vinci Hair Nigeria, Vinci Hair Ghana. Send us a DM and we can guide you into selecting the best supplement to help with your hair growth, right? And just other tips that I want to share with you for the hair as well. Protein, she mentioned, 80% of the hair is protein. You want to make sure that you're taking your soya milk, you're taking your beans, taking your fish, you're taking your chicken, you're taking your vegetables as well, all right? And this is Vinci Hair Clinic, and basically what we do is hair restoration. So if you have any questions, any issues with your hair, do send us a DM, and we have people who are ready to assist you. At least in approximately 6 hours, you'll be getting a response from us. Right, so the Confident You live video series happens every Friday, and hopefully next week Friday we'll be having another intelligent mind on the show, and we shall be advising you on how best to stay healthy. So once again, I'm Dr. Tunde Adefe, and I'm signing out from Vinci Hair Clinic. I want to say have a good Friday. Stay confident, stay beautiful, stay healthy. All right. So till we meet again another Friday, it's gonna be have a nice evening. Bye.